So last lecture, we talked about old research into memories of emotions towards events. And in this lecture, we'll look at more recent new research that investigates memories of emotions towards people. So this has even more relevance to memories of relationships than the previous lecture. So I thought it would be a good opportunity to share some insights I have had since the first lecture. Immediately after the lecture, it occurred to me to remind you that this effect of changing cognitions affecting memories of emotion can sometimes be a small effect, sometimes negligible. If current cognitions do not change much, then memories of emotion are likely not to change. Indeed, when we do try to manipulate current cognitive appraisals experimentally in short exercises in the lab, we often only notice a small change in memories of emotion. So this is a small effect. And Linda Levine, back in her 1997 paper, also noted this idea that memories of emotion are often accurate, but at the same time they are vulnerable to distortion. So last lecture, for example, when I used the COVID-19 example, I was only doing so to get you to think about the mechanism and the theoretical relationship between variables. But I should add that that research has not been done on COVID-19 about memories of emotion towards that news event. I should add that in many instances, people's recall of how they felt initially about COVID-19 will likely be accurate. My argument is that it is possible for inaccuracies to occur, and if we do find inaccuracies, perhaps the best explanation would be changing cognitive appraisals of the events. Now, you will notice that a lot of the past research relates to memories of emotion towards events. Very little has been done asking about how participants' memories of emotions change towards people rather than events. Notice in the Ross Perot paper, Levine's 1997 paper, which was one of your readings, that memories of emotion were about an event, Ross Perot's withdrawal, rather than asking about memories of emotion towards Ross Perot himself. Similarly, in the O.J. Simpson article, which was Levine et al. 2001, it was all about memories of emotion felt towards the not guilty news, which was an event, not memories of emotion towards a person. Similarly, in the grief study by Safer et al., it was about the memories of emotion about the loss of a spouse, which is an event, not about memories of emotion towards a person. So you can see a gap in the literature. So in this lecture, we will delve into some research, which is your primary reading, Patias et al. 2019, that explores memories of emotion towards a person. I think this is important research because it can be important in relationships with others, not just parents, as is the focus of that article. And it's particularly relevant to clinical psychology, where emotions felt towards others might be explored. In addition, very little past research explored memories of emotion malleability of childhood events or childhood relationships. So this research fills that gap in the research too. Of course, this is a cautionary tale of the possible negative side effects of reappraising other people or reappraising past events. Your memory may change, and you might not even know your memory has changed. Okay, let's examine this study in more detail, and I hope this helps you in your reading. So let's first summarize what this Patias et al. Reading finds. Right, so this article demonstrates that memories of emotion towards a person are reconstructed, and they are biased by present cognitions or cognitive appraisals, whatever you want to call them. Now, in particular, the emotion focused on here is feeling of love, which was chosen just because it's an important emotion. And the person, the target of this article, is mother. So it's all about memories of love felt towards mothers. Mothers were chosen, of course, because they're important people in people's lives. And this article also extends the memory of emotion literature to memories of childhood emotions for the first time. And of course, this has relevance to any treatment in clinical psychology that explores childhood or explores childhood emotions. So the first question is, why is this research important? Well, first, we use memories of our emotions to make many important decisions and judgments. They're important in personal relationships. For example, we make decisions about how often to meet people, depending on our memories of emotion towards that person. And as mentioned in the last lecture, we make decisions on whether to marry people and so on. And specifically to this talk, we use memories of emotions when we make judgments and decisions in family relationships. So the idea is how we remember love and affection, or how much we remember feeling towards our parents, will probably influence our decision making in the present day. For example, decisions on how much we are prepared to support parents, how often we write to them, how often we visit them, and so on. This is the theory behind possible consequences of changing memories of emotion. Also, if we bias our memories of emotion in childhood, that might change our parenting techniques. For example, if we bias our memories of emotion in the positive direction, we might retain parenting techniques that we should really throw out from the last generation. If we negatively appraise our childhood in a negative direction, we may end up throwing out good techniques from the last generation that we should keep. In extreme circumstances where you reappraise childhood to such an extreme degree that your whole memories of emotion change about how you feel, it could possibly lead in estrangement between offspring and parents too. So we would hope that memories of love and affection that we felt in childhood would be accurate. This is the motivation for the study. So the theory that you're familiar with already from last lecture is that changing cognitive appraisals will change emotions. Now we also know that memory is reconstructed from current knowledge and cognitive states, and current cognitive states. So there's research by Frederick Bartlett, Elizabeth Loftus on this, which leads us to the next theory, which is that memories of emotions are malleable according to current appraisals. So this is Levine, 1997. I've talked to you about this already, but I wanted to remind you about it and reframe the theory. So the theory goes that current appraisals of X, and X can be a person, such as a mother, or an event, is a causal factor in memory of emotions towards X. Right, so memories of emotions towards a mother in the example of our article we're going to discuss. So this is one causal factor, and it's a small causal factor. And there are other factors, of course. And just a quick reminder of the past research that I mentioned last time in the last lecture. Of course, you have Levine's article, and a couple of experiments, but not enough, such as the SAFER article and the Hovaspian article. But what we concluded from this past research is that more experimental research is needed to establish a causal relationship, or to at least add some evidence that there's a causal relationship between changing cognitive appraisals and memories of emotion changes. So the study we're going to look at not only expands the research into interesting areas such as memories of emotions towards people, important people, and memories of emotions towards childhood, it also helps establish a causal relationship. So to draw you into this research just a little bit more, I want us to think about how appraisals towards parents could change. And of course, this applies to other relationships too, not just parents, but let's just focus on parents for now. So outside of the lab, how can our appraisals change towards parents? And then perhaps if they do change, maybe our memories are changing with them and we don't even realize it, right? So one idea is that when our parents get divorced, if our parents get divorced, that could lead to some reappraisals of one of the parents, or maybe both of the parents, right? You know the mechanisms involved there. You can imagine them. Also, another thing that could happen is getting new information about the parent. Perhaps it's negative information that's actually true information, or maybe it's not true information. Regardless, it will change our current appraisals of who our parents are, right? As parents age, their personalities may change slightly. They may become better people, or they may become worse people, and then our current appraisals of them will change. Parents themselves may change for other reasons too. So this may change our current appraisals of them. And the question is, do our memories change too? Another way that our appraisals of parents can change is if we have a child ourselves, or if we become older ourselves and we learn more about how the world works. Another way that appraisals are changed in some psychotherapies, they work on changing appraisals of childhood to move around in the participant's mind their appraisals of why they have problems in the present. Self-help books also may, if they focus on childhood and reappraising childhood, may lead us to reappraise our childhood and parents. Or if the self-help books re-evaluate what being a good parent is, then we may reappraise our parents. Sometimes, of course, these reappraisals are unfair. Sometimes they may be more fair. Another possible way that we might appraise our parents is if we have tremendous success, right? So you can imagine somebody being very successful and then they attribute their success to their parents, right? So their appraisal goes up for their parents in some cases. Another way that we might reappraise our parents is if we have some motivation to spin a different narrative of our life, you know, and as we go through life, our narrative of our childhood tends to change. And sometimes the motivation is to change it in an upward direction. Sometimes the motivation is to appraise it in a downward direction. So these are all ideas that I'm sure some of you can relate to. I certainly can relate to some of them, about how we might reappraise our parents over time. And of course, this applies to how we reappraise, you know, siblings as well, and how we reappraise close partners or friends as well. So this is a broad idea. Now, in some way, I think this is pointing out the obvious, but in this reading that you have, the basic theory behind it, of course, is that if you change the current appraisals that participants have towards their mothers, right, so how they currently evaluate their mothers or how they judge their mothers right now, it's all cognitive, will have a causal effect on memory of love felt towards mothers in childhood. So for you to understand this article just a little bit more, let's talk about the methodology and the design of the study. So first of all, to make it clear, the independent variable here is current appraisals of mother. In other words, current evaluations or judgments of the mother's attributes. Independent variable in an experiment is the variable that you think is the cause, and then you try and manipulate that causal variable. So the way we manipulated this variable in this experiment is that we asked participants to write out several sentences giving recent examples of when their mothers showed generosity, warmth, good guidance, just to bring to mind all the positive aspects of their mothers, so that they come to increase their appraisal of their mothers in the appraisal up condition. In the control condition, we did not do any manipulation, and then we had an appraisal down condition where we got those participants to write out sentences of recent examples showing where the mother showed a lack of generosity, a lack of warmth, and a lack of good guidance. So we relied upon the participants' own writing out of positive aspects of their mother or negative aspects of their mother, or in a control group where they did not write out sentences about their mother at all, to manipulate or change very slightly individuals' current appraisals of their mothers, so how much they valued their mothers on generosity, warmth, and so on. So we had an appraisal up condition, as I mentioned, where people wrote out sentences of how generous, warm, and good guidance their mothers had shown very recently. We had an appraisal down condition, as I mentioned, and we had two control conditions, where we tried not to manipulate or change people's current appraisals of mothers. And the outcome variable that we measured, or the dependent variable, is the memory of love that the participants felt during a certain time in childhood. For example, we asked participants, during first grade, during the whole year of first grade, how often did you feel love towards your mother? So questions like that, and several other similar questions were all summed together to make a scale measuring memory of love felt in childhood. So I should also mention that the participants were US adults who participated online for payment, and their average age was about age 37, with a broad range of ages from age 18 up into the 60s and 70s. And here is what you have to do first when you run experiments, and that is check whether the manipulation of the independent variable, which is current appraisals of mothers, actually worked. In other words, did the manipulation actually change what it should do, which is the current appraisals of mothers? If so, you can carry on with the analysis. If not, then the experiment has gone wrong and you've got to find a more powerful way to manipulate the independent variable. And as you can see from this graph here, that indeed it did manipulate it, and these are significant differences statistically. So you see the mother appraisal down condition had the lowest average of current appraisals of mother. The two control conditions, which were called the null and the teacher appraisal down condition. The teacher appraisal down condition, by the way, substituted the name mother for teacher, and you can see that in that manipulation, the teacher appraisal down condition did not significantly change appraisals of mothers. And of course, the mother appraisal up condition did indeed have the highest current appraisals of mothers. So this is the first step in checking an experiment. You check whether the manipulation has changed the independent variable itself. And now on to the main results of the effect of the condition on the dependent variable. So as we thought might happen, changing individuals' current appraisals of their mother did indeed change memories of love towards their mother. In particular, on this screen, we see memories reported about how much they felt love during grade 1, which is approximately age 6 and 7 in the United States. With mother appraisal up condition, of course, remembering feeling more love towards their mothers in grade 1. Now remember, these individuals were randomly assigned into groups, so this is likely because of the manipulation. The manipulation that we put in our experiment of current appraisals of mothers. So this is some preliminary evidence that changing current appraisals changes memory of emotions for childhood. Similarly, we found similar results when we asked individuals to recall how much love they remembered towards their mothers at age 11 and 12, or grade 6 in the United States. And again, the mother appraisal up condition, which manipulated appraisals upwards, was significantly higher in that memory of love than the mother appraisal down condition. Again, there's some more cumulative evidence that there's an effect here. Similarly, for memories of love towards mothers at grade 9, which is approximately age 14 to 15 in the United States, again, the mother appraisal up condition was higher on memories of love than mother appraisal down condition. And as we would expect, the null conditions, or the control conditions, were in the middle range of those two extremes. Now, by using the experimental method and random assignment, we have the foundations here of a potential causal relationship, but we should not be sure that there's a causal relationship yet. There could be some confounds involved. The pretest levels of memory of love between conditions may have been different because we could not measure pretest levels of memory of love. That's one potential problem. The other potential problem is just that this is a fluke that needs to be replicated. So we address these potential confounds in the next experiment. Now, before we move on to experiment 2, there's some interesting results about current feelings of love. So according to Lazarus's theory that cognitive appraisals have a causal relationship with current emotions, we found here some evidence to support that idea. So in the mother appraisal down condition, for example, participants' current feelings of love towards their mother was less than those in the mother appraisal up condition, who felt much higher current feelings of love towards their mothers. Now, in an extension of experiment 1, we followed up 2 weeks later and asked the same series of memory of emotion questions, and then we followed up again 4 weeks after the experiment to ask those memory of emotions questions too. And you can see that the effect endured over time. So the differences between mother appraisal up and mother appraisal down seem to continue for up to 4 weeks or more. So you can see the manipulation we did at week 0 seemed to lead to an effect that lasted at least some time. Now, experiment 1 gives some preliminary data to suggest that changing cognitive appraisals will change memories of love in childhood, but there's some potential confounds that make it necessary for a second experiment. So, for example, we were not able to measure pre-existing differences in memory of love between groups. We just were able to measure those variables after the random assignment into groups. Also, the independent variable manipulation may not have caused the differences between the groups. It may have been pre-existing differences. Now, this is unlikely, but we checked this confound with a second experiment where we use a pretest post-test design. Now, the reason we did not use a pretest post-test design in the first experiment is because it's so difficult to do, because you have to have a long gap between pretest and post-test measures of memory of love so that the participants will forget how they initially answered. Otherwise, they will just remember how they previously answered on their memory of love, and they will just repeat their previous answers. So in experiment 2, we took pretest measures of their memories of love towards mothers in childhood 8 weeks before we did the experiment. So that gives enough time for the participants to forget how they answered the first time. And we had 2 conditions in this experiment. One was a mother appraisal up condition, where we attempted to raise people's current cognitive appraisals of mothers, and the mother appraisal down condition, where we did the opposite. We tried to lower current appraisals of mothers. And here you see the results, right? So at pretest, they're quite close in their memories of love towards mothers. In this case, this graph is showing memory of grade 1, which is age 6 and 7 in the United States. And you can see how those lines diverged after the experiment, where after the experiment there was a larger difference between the memory of love remembered in the mother appraisal down condition, that went down, mother appraisal up condition, that went up, and the measure of whether this is probably a causal relationship is doing an interaction between time and appraisal condition, and indeed there was a significant interaction between these 2 variables. Now, there were similar results on the variable that asked individuals of to to what degree they remember love towards their mother at grade 6, which is age 11 to 12 in the United States. And you can see at pretest, both groups were about the same, 4.1 out of 6. And the two lines diverged after the experiment, with mother appraisals up, going up slightly, mother appraisal down, going down slightly. And the difference between the two groups after the experiment was a significant difference, statistically significant difference. And for memories of love felt towards their mother at age 14 to 15, or in grade 9 in the United States, you can see that on the pretest there was no significant differences between their memories of love between the mother appraisal up condition and the mother appraisal down condition. But after the experiment, there was a significant difference between conditions. So you can see from these results, with just a 10-minute manipulation in an experiment, you can change memories of emotion in the participants of the participants' childhood. Now here is perhaps the strongest evidence that memories of emotion can be inaccurate and how they might change from the original emotions. So let's explain this as carefully as I can, because it's one of the strongest pieces of evidence in the article. So at pretest, at week 0 we might call it, we asked individuals, to what extent do you feel love to your mother right now, right? So what is your current feeling of love towards your mother? And we asked it in a whole bunch of different ways, and we summed together into a composite variable. And then 8 weeks later, we asked them the same questions, but in retrospect. So we asked them at pretest 8 weeks ago, how much love did you feel towards your mother, right? Just exactly the same questions, but asking about 8 weeks before. So in this case, we had an accurate measure of their initial feelings of love, and then we had a measure of memories of that love later, 8 weeks later, after the experiment. Now, the interesting thing here is there was a significant difference after the experiment between the mother appraisal up condition, which went up from the initial measure, and the mother appraisal down condition, which went down from the initial true measure of current feelings of love towards the parents. So this demonstrates that changing cognitive appraisals can change memories of emotion as recently as 8 weeks ago. So what we found is that in 2 experiments we had a replication of results. So we can conclude that the independent variable, which is cognitive appraisals, probably is the reason why the dependent variable changed, which is memory of emotions. So why can we say this? First of all, there was a replication over 2 experiments, but also in the second experiment, we took pre-test and post-test measures, and we could see those measures change from before the experiment to after the experiment. So we're not completely sure that one is causing the other, but it's some evidence that it is. So some evidence that current appraisals of mother is a causal factor in memories of love towards that mother. And it's more evidence in general that there's a general causal relationship between cognitive appraisals towards an event or a person and memories of emotion towards that event or person. And also what this experiment does is it expands the research from memory of events, which is interesting, into a meaningful area of relationships, such as memory of emotions towards important individuals in somebody's life, and memory of emotions towards people instead of events. And also I should note that other emotions also changed. We focused on the emotion love because it's an important emotion between parents and offspring, of course. But we also measured other emotions such as happiness and anger, and those also changed in the direction that you would expect them to change. So feelings of memory of happiness, for example, went up in the mother appraisal up condition. memory of anger went down in the mother appraisal up condition, and so on. So I don't want you to think of these results as being specific to only the emotion love or only the target person as a mother. The general idea is this probably generalizes to other emotions and other target people in our lives, such as friends, siblings, and so on. We think this is probably, given not just this research, but the past research I talked about in the last lecture, is probably a generalizable theory. Now, I suggested earlier that there's possible consequences to changing memories of emotions. Remember that I said that our memories of emotions might alter our decision making in relationships and so on. So the question is here, were there any possible behavioral consequences, so how behavior changes in the future, to these changes in appraisal and memory of emotion? That's what we try to measure in experiment 2, where we asked participants what their plans were for the future in their relationship. Now, to get an idea about possible consequences to these changes in memory of emotions, we asked participants both before and after the experiment, how much do you want to visit your mother currently? And we gave them a 7-point scale to choose from. Now you can see at pre-test, 8 weeks before the experiment, there was not any significant difference between the mother appraisal up and down conditions. But after the experiment, you can see that mother appraisal up condition showed significantly more willingness to visit their mother compared to the mother appraisal down condition. So this is some evidence that maybe changing these appraisals and memories of emotion might possibly have a behavioral effect. Now, this is based on the assumption that these desires to want to visit their mother may result in different behaviors in visiting their mother. Now, that's something that we were not able to directly measure how often they visited their mother, so this is speculation that there may be a behavioral consequence. Now, we also asked participants 8 weeks before the experiments and then immediately after the experiment, how frequently will you visit your mother in 10 years' time? And as you can see, we found similar results to before, where at pre-test there was no differences between groups, but after the manipulation, after the experiment, you can see that mother appraisal up condition were much more likely to say that they will visit their mother frequently in 10 years' time compared to the mother appraisal down condition. And again, they may be, if these appraisals and memories of emotions stick, there may be some behavioral consequences, although we can't be sure from these results. And we asked also, before and after the experiment, how frequently will you visit your mother in 20 years' time? And we gave them a scale from 0 to 6, a 7-point scale. And again, we found at pre-test there was no difference between the groups, but in the mother appraisal up condition after the experiment, the estimated frequency that they'll visit their mothers went up. So this could possibly result in changes in behaviors, even from a small manipulation in an experiment which lasted just 10 minutes. I think the point here is that if you reappraise parents in a larger way with years of psychotherapy perhaps, then you may see even bigger effects on possible behavioral consequences such as frequencies of visits and so on. And we also asked, how much social support are you willing to give your mother currently? Now, before the experiment, it was about equal between conditions, but that difference grew with mother appraisal condition going way up, mother appraisal down condition going down, and there was a significant difference after the experiment where those who had appraised mothers in the upward direction were indicated more willingness to give social support to their mother. We also asked, both before the experiment and after the experiment, how much social support are you willing to give your mother after she reaches the age of 70? And as you can see, there's an interaction here where at pretest, the measures were similar, mother appraisal up and mother appraisal down, no significant difference between the two, and at straight after the experiment, you see a difference where mother appraisal up condition is higher than mother appraisal down condition. We also asked how much financial support are you willing to give your mother after she reaches the age of 70, and again we found a significant interaction. So at pretest there was no differences between groups, and then after the experiment a mother appraisal up condition again indicated much more willingness to offer support, financial support in this question at the age of 70, a significant differences between groups after the experiment. Now let's discuss those findings on the possible planned consequences of changes in memory of emotion. Now I should point out that it was too difficult to measure actual changes in consequences, such as how often they actually visited. So in this study we just looked at planned or likely changes in behavior. The assumption that these changes in self-assessed likelihood lead to actual changes in behavior in a relationship is uncertain. But if that assumption is true, then changing memories of emotions can lead to changes in supporting behaviors in a relationship, such as visits and social and financial support. So if memories of positive emotions go up, visits and support might increase. If memories of emotions go down, visits and support may decrease. So let's discuss the findings of these research articles that we discussed today in part 1 and part 2 of the lecture. So first, memory of emotion is malleable. So in several different studies, they showed that changing cognitive appraisals may be the reason why memories of emotions change over time or due to changing appraisals. Now this is consistent with Levine's 1997 theory that changing cognitive appraisals leads to changes in memories of emotion. We also have found that current feelings of emotion is also malleable. So in other words, as our appraisals change in the present, our current feelings change, our current emotions change. So in the study by Patias et al. We just talked about, changing current appraisals of mothers led to changing current feelings of love towards mothers. Now this is consistent, of course, with the cognitive appraisal theory of emotion put forward by Lazarus and Arnold and so on. We talked about that in a previous week's pair of lectures. Now in this Patias et al. Article, we also added some evidence to the idea that the causal factor behind these changes is current appraisals. And I should also mention that in our study, we controlled for mood to test whether mood had an effect on memories of emotions, maybe more so than current appraisals. But no, we found that current appraisals had a much higher effect on changes in memories of emotions and current emotions than mood did. So we think that these cognitive thoughts and evaluations are more important than mood. And we also found in our study that there's potential consequences, or at least planned consequences, in future behavior in terms of number of visits to the target person and the amount of support the participants were willing to give, both social support and financial support to the target person. Now, the existing research suggests that these effects are not confined just to one or two variables, or one or two emotions, I should say. So in our article, for example, we found that memory of love changes, but it is also the case that in other articles and other research that I have done as well, you find that changes in other emotions happen too. So memories of anger, memories of distress, memories of grief, even memories of pain change. And these findings are likely not confined to just mothers, right? So these extends to other people too. In other research, There have been findings about Ross Perot, O.J. Simpson, and feelings about the death of a spouse, of course. Now, there is a lack of evidence of memories of emotion towards other individuals rather than events, and that's the gap in the literature. But the theory suggests that these kind of findings will likely apply to other individuals too. So, for example, you could do a study on memories of emotion towards siblings or memories of emotions towards partners, and the theory would predict that your memories of emotions can change towards those individuals too. Now, these are interesting hypotheses to have in mind for somebody who goes into clinical psychology and helps individuals work through their emotions. And sometimes you find that clients will have a disagreement in their memories of something that happened in their past relationship, where one person will remember one set of emotions, the other person will not agree that those emotions were present at the time. So I want you to put some individual thought into how these findings might apply to people or emotions that you're interested in, right? So maybe your own past experience might make you do a thought experiment into how these things might apply and how your memories of emotions might have changed towards people yourself and you didn't even realize it, and so on. So I just want you to get to think about this for yourselves in your own lives. And another question is about how does this apply to psychotherapy? So should it be part of informed consent that people know that if they do reappraise childhood, or if they do reappraise the relationship with their spouse, or if they do reappraise the relationship with their boss, should it be part of informed consent before therapy starts that the patient is told, or the client is told, that if you reappraise events, your memory of emotion might change towards those events, or if you go along with this therapy and reappraise parents to a great degree, this may have the unfortunate side effect of changing your memories of emotion towards parents in your childhood, right? So people can then decide whether they want to change their memories of childhood or not, and this is like giving consent about a possible negative side effect. My idea here is that it is a negative side effect to change memory because you want to preserve accuracy in memory so that decision making in your own life can be improved. But some other people may not have that same philosophy of conserving the accuracy of memory, and they may consent to slightly changing their memories of emotion in childhood, for example, especially if those changes are in a positive direction. I personally would not want to lose any accuracy. So that's it, and thanks for listening. I hope you enjoyed this deep dive into memories of emotions, and I hope I have provided you with some of the provocative ideas and findings that have fascinated me so much. I think this knowledge can be helpful for psychologists so that they can practice in a careful and informed way. And indeed, I think further knowledge in memory research and the basic constructive nature of cognition in general is a helpful grounding for clinicians. So I recommend cognitive psychology for potential clinicians. Much in the same way that basic biology of the human body is a good grounding for medical clinicians.